let's start with common childhood infections. So, to remember the dates, there's a mnemonic named very sick persons must take rest. Okay, now what to do? The dates. For varicella, in the very first day of fever, rash will appear. S for scarlet fever. P for pox, that is smallpox. On the third day of fever, rashes will appear. Next comes M for measles, as well as measles opposite roseola. In both cases, on the fourth day, the rashes will appear. And last is T for typhus, that is on the fifth day, and the last one is rickettsia. Okay, so this is the 1 2 3 4 5 and 6. Okay, now there are few key differences between the types of rashes, like we can easily remember, that is for roseola and varicella, the rash will first appear on the trunk, and for all the other cases, that is scarlet fever, typhus, rickettsia, the measles as well, the first place where the rashes will appear is the face. Okay, now come to the important stuff. Let's talk about the measles. It is important for prof as well. So measles is for single stranded RNA virus. Okay, mode of spread is respiratory droplets. That's why it is highly infectious and contagious. The 4 days before to 5 days after the onset of rash, the infectivity period. Now the clinical features, it is important the way it goes. At first, prodromal stage happens, that is day 1 to 3. Their fever along with coryza, cough and conjunctivitis, that means cough, নাকে জল এবং চোখে জল, all three can be seen in the very first stage. Then from the 2 to 3 third second to third day, we find coptic spots inside the mouth, that is seen in here. It is nothing but a white spot surrounded by a red border. This is the coptic spot and it is important. It is characteristic for measles, that is white spots surrounded by reddish hue, usually opposite to the second lower molar teeth, and it is seen on tongue and lips. It gives a rice grain or grain of sand appearance. Next, after that, we can see the maculopapular rashes. It happens at first in face, behind the ear, and spreads downwards on the trunk and leaves spots after healing. It leaves behind a brownish spot pigmentation, and the fever intensifies after the rash appears. Okay, that's the measles. It will be on the face first, behind the ear, and then spread downwards. Now let's talk about how to manage the measles first. Okay, so the management is supportive treatment, that means adequate nutrition, antibiotic and IV fluids. Along with that, we give vitamin A supplementation that decreases the mortality and morbidity. We give two doses 24 hours apart orally. It is in the MMR vaccine is also available. The doses of vitamin A, if the child is less than 1 year, then we give more dose, that is 2 lakh international unit, and it is more than 1 year old child, then we give 1 lakh international unit. That means এক বছরের বাচ্চাকে 1 লাখ ইন্টারন্যাশনাল ইউনিট দেবো পার ডোজ। Two dose will be given, okay, into two dose. Next comes what are the complications. The most important complication is otitis media, is the most acute complication. Most severe is pneumonia. Pneumonia due to obviously streptococcus pneumoniae or staphylococcus aureus, or due to virus, that is giant cell pneumonia or hecht pneumonia due to virus in measles. Okay, if the chronic complication is subacute sclerosing panencephalitis, it is a rare condition. It happens when it is a latent complication. When happens if the child 7 to 13 years after the primary infection, that means if the child have the measles in the age of 2 years, he can have the subacute sclerosing panencephalitis in the age of 9 years or 15 years. Okay, the clinical features will be, the most important is myoclonic seizures. Seizures will be happen in this SSPE. Personality changes, cognitive impairment, deterioration in school performance can be seen. It is a fatal condition, it can be deadly. Okay, the diagnosis is done by IgG anti-measles antibody present in the CSF, or EEG, that is red maker complexes are seen. The treatment is mostly supportive using gamma interferons and isoprenosine. That's it for measles. Now, one thing that is similar to measles but opposite as well, that is Roseola infantum or Exanthema subitum, that is 6 disease. Okay, what happens here as well, this is due to human herpes virus 6, the Roseola infantum happens. It is the 6th disease, that's why. Next, let's talk about the Rubella. Rubella is single-stranded RNA virus, so nothing complicated. It is a RNA virus. R for Rubella, it is RNA, and obviously RNA is single-stranded, so it is PYQ as well. Toga viridi is the etiology. It calls German measles. So German measles or 3-day measles is called rubella. Why? Because the maculopapular rash, also seen in measles, are present here for just 3 days. Okay, but the difference is that in the 4th day of fever, measles rashes appears, whereas in rubella the first sign is rash. That means on the day 1 of illness the rashes can be seen, so there is no prodromal stage. Prodromal stage means fever, coryza, conjunctivitis seen in measles. Here is nothing like that. So no নাকে জল পড়া, চোখে জল পড়া, direct rash in case of measles. The infectivity period is 5 days before to 6 days after the onset of rashes. Happens through respiratory droplets. Now it starts from behind the ear as well, that means from the face then to the body, but no spots will be left over, so no spots. There are two spots, names is Fortschimmer's spot, that is tiny rose lesions on the oropharynx, on the mouth. Okay, so if it is the mouth, so there will be spots in the mouth. And lymphadenopathy, that is suboccipital, posterior auricular and anterior cervical lymph nodes, these parts, lymphadenopathy and four-seamer spot. In case of measles, we seen Koplik spots. In Roseola, we seen Nagayama spots. Here in Rubella, we are seeing four-seamer spots. Next, what are the complications? Complications, the most severe one is progressive rubella panencephalitis, most severe, and the other ones are arthritis and thrombocytopenia. MMR vaccines, there R stands for rubella. Okay. Now let's talk about the Erythema Infectiosum. Erythema Infectiosum is done by parvovirus B19. It is a single-stranded DNA virus. Okay, parvo is single and DNA obviously. So single-stranded DNA virus, incubation period is 4 to 28 days. Age group more than 5 years. That means simply school-going children can have this. School-going children. What is the important things about this? The fever for 1 to 2 days is the prodromal stage. Then we have the first rash is in the face, that is slab cheek appearance. Slab cheek appearance, at first it will happen in the face, then it will move towards the trunk just like the others. Okay, so diffuse macular edema, and in the third stage we have a central clearing of rash, that is lacy appearance or reticulated appearance. That means in the center is white, whereas this the border is red. This is the lacy appearance or reticulated appearance. That means central clearing of rash seen in Erythema infectiosum. The management is supporting management with good prognosis. What are the associations? The associations are, the most important is infection in mother during pregnancy can lead to hydrops fetalis. Hydrops fetalis and stillbirth. So it is the most important. Other than that, arthralgia, that means joint pain, and transient aplastic crisis. Aplastic crisis means a sudden temporary cessation of red blood cell production in bone marrow. Okay, often triggered by the viral infections like parvovirus P19. So RBC production stopped by parvovirus B19 infection. Pre-existing hemolytic anemia plus parvovirus B19 infection or presence with pancytopenia, that means everything is lower. Okay, that's it. Let's talk about the epidemic typhus. Okay, comes once in prof, so it is due to rickettsia prowazekii. Okay, the treatment is doxycycline for 1 week and 3 days after the febrile, and transmitted by feces of infected body lows. The three triad of symptoms are, obviously, the first one is fever along with headache, matha and rash on the fifth day. Here in the palms and soles we have the rashes. Now let's talk about the last one, that is hand foot mouth disease, HFMD, due to Coxsackie A16 virus or enterovirus virus 71. It happens in preschool age, that means under 5 years age. Happens due to direct contact or used towel. So keep, it is, as it is very much infectious, keep the babies in the home, keep in isolation children. Here also, just like typhus, we can see papulovascular lesions in the soles and palms. Here HFMD and typhus, we have sores and palms, and blisters can be seen around the oral cavity. That is the first manifestation, these blisters. Okay, so fever, ulcer, blister can be seen in HFMD. Treatment will be supportive. Most common complication is temporary loss of nails for 4 weeks after the initial infection. Okay, let's do a very quick and comprehensive study of the infectious disease that we have just read. The first one is rubella. Okay, so the rubella is also known as rubella virus. Rubella, as well as known as toga virus. It is also known as German measles or 3-day measles, because the rash only there for 3 days. Now, on which day the rash appears? It appears on the very first day of fever. Rash type is, obviously it is named as measles, so it will be maculopapular rash, where on face, behind the ear, on face at first. There is no prodromal stage on the day one happens, so no prodromal stage. Chest to trunk. Okay, scars left, no. Treatment, we have the supportive care. I will write it as SC from now, and we have the MMR vaccine. Now, any special spot is there, that is for Schweimer spot in rubella. Okay, on where? In the palate, that means in the mouth, in oropharynx, but writing as mouth. Okay, it is done. Next comes the varicella one. That is also known as chicken pox. By the way, rubella is RNA virus, and obviously RNA, so it is single stranded. Here it is chicken, so it is DNA and double stranded. So varicella zoster virus. What have we here? Here one thing is important, that we have polymorphic rash. That means different stages of rashes can be seen all together. Polymorphic rash, that means ছোট বড় সব রকম rash পাওয়া যায়. Polymorphic rash can be seen. Okay, it also appears in 1 to 2 days. Scars left, yes, scars will be left in chickenpox if scratched. What we have here is dewdrop rosy appearance on rose appearance. What is the treatment? The treatment is here supportive care as well as acyclovir. Within 48 hours. And the next important thing is avoid aspirin, and ibuprofen. Ibuprofen. These two things must be avoided. Okay. Next comes the Scarlet Fever. Scarlet fever is the only bacterial one, that is Streptococcus pyogenes, that is group A Streptococcus, beta hemolytic Streptococcus. So pus can be seen, pus seen because bacterial. Okay, which type of rash we have? We have sandpaper rash. Sandpaper rash, where strawberry berry. Here it happens in trunk first. Here strawberry tongue, cheap, and pasties in elbow. In elbow we have pasties line. Here it happens from face to trunk, but no palm and sole. When it appears, around 2 days. No scars, but we give penicillin, oral penicillin free, or amoxicillin as well can be given. And special lines are all this. Those are the special lines. Smallpox. That is already eradicated. It is Variola virus. We have same size, same stage rashes on the 3rd to 4th day. We have scars. It is already eradicated due to vaccine. Okay. Next is measles. That is obviously measles virus, that is paramyxiviridae. Paramyxoviridae. It is also a RNA virus, so SS. Okay. We have maculopapular rash as well, from face to trunk, On the fourth day, after the prodrome, here no prodrome, here prodrome is present. Scars left behind, no. Sorry, yes, pigmentation happens, and fever intensifies after the what treatment? Oblique spots can be seen, and the treatment is supportive care, vitamin A, and MMR vaccine. Next, on the fourth day as well, we have Roseola. That is Exanthem septine. It is the sixth disease. Why sixth disease? Because it is due to human herpes virus 6 or human herpes virus 7 as well, but 6 or 7 both. Echovirus 16 as well, but not necessary. We here have the same type of rash, macular rash, but it appears on trunk first. It appears also in fourth day, but no pigmentation appears. And here, after with rash, fever increases. With rash, fever decreases. Okay, so that's it. What is the treatment? Same as before, supportive care as well, but yeah, nothing else. We have Naga Yama spot on mouth, uvula. These are nothing but ulcers on mouth, inside mouth, uvula and soft palate. Okay. Next comes Erythema Infectiosum. That is the fifth disease actually. But why I am writing it here? Because it appears on the 5th to 6th day, 3 to 7th day. So I am writing it to 6, 7. 3 to 7 day. What happens in here? We have parvovirus B19. Now parvo is single stranded, but he is also human, so it is DNA, single stranded DNA virus. It is a previous year question as well. It happens to school going children. We have here what we have slapped cheek appearance. That means face first, then trunk, and then we have lacy reticular rash on limbs. Lacy reticular rash. Previous year question as well. These two are previous year question as well. Okay, next is no scars are left behind, supportive care, is given as well. Here slapstick appearance is the important word in this case. The next one, Epidemic Typhus. It is by Ricket Shear. It is a bacterial one. It happens when on the 6th day, so I can write it as 5 for my sake. So it appears on the 6th day. Here we have as well maculopapular rash on trunk. Then to extremities, but no hand and soles or palms and soles are spared. What is the treatment? Is doxycycline for 7 days and 3 days surplus. Okay. Let's talk about the last one. That is hand, foot, mouth disease due to Coxsackie A16 virus or enterovirus 17. Here, only in this case, palm and soles have rash, along with mouth ulcers. It is 7. No, it is 1 to 2 day. Okay, no, nothing happens. We do supported treatment. So that's it. It is an entirely important one. Some things are important to remember, like Erythema Infectiosum. We have slap cheek appearance and a lacy reticular rashes. This is previous year question. Then rubella. In case of rubella, we have what? We have four-streamer spot, fine rash. In measles, we have the 4th day and Koplik spots. In Roseola, rash after fever disappears. Rash after fever gone. Typhus, we have truncal rash sparing face, palms and soles. So no face, palm and sole are left. Whereas HFMD, we have palm, soles, mouth ulcer as well, just opposite of this. Mouth means face as well. So that's it. In case of smallpox, we have pitted scars. It is pitted scars and uniform stage vesicles, same stage rashes and vesicles. Next is varicella. Rash is multi-stage, whereas varicella has polymorphic multi-stage rash and they will be itchy. Okay, and itchy. Shurkan, chickenpox. In scarlet fever, what we have? We have strawberry tongue, pustules, lines, and sandpaper rash. All are previous year question. That's all.